so much. All right, everybody. Thank you so much for joining us here for the Incarceration Prevention and Reduction Task Force Law and Justice Council meeting for September 23rd, 2024. Appreciate everybody taking the time to be here. We have a full agenda today, and as you may recall from last month's meeting, we are in the middle of an exercise where we are looking at the implementation plan, roles, responsibilities, and such, and this will be this process will be led again by Holly O'Neill. Let's see. Heather, my co-chair, is joining us today, but only as she's listening in. Baby Booker went to the hospital late last week and is okay and back at home, but she's going to need some time to just spend with Baby Booker, and but is listening in today, but will not be participating. All right. I'd like to read the land acknowledgement. And Jill, if you could just move the screen up a little bit so I could read that. Thank you so much. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge that what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us here together today. Bring us together here today. And please join us in uncovering such truths at any and all public events. All right, we will call this meeting to order. Our first order of business is to continue on with this exercise that I spoke of earlier. But first, I'd like to give you a little bit more context. As you know, we have spent the first part of this year, Heather and I, doing a lot of listening, a lot of asking questions of the IPRTF in this meeting, in the committee meetings, and we gathered, we gathered our findings from what we heard. We wrote a report. We made recommendations. We have taken it to the steering committee, and in our last steering committee meeting, we went through this with our co-chairs to discuss the priorities for the IPRTF as Heather and I saw them. Also, we broke things down, all the findings down into 4 key finding categories. We reviewed the next steps for each category. How can each committee contribute to accomplishing next steps? We asked what is missing from the findings and recommendations. And we asked how can committee work align to achieve the goals that we've got? And then next steps for creating an 18-month IPRTF work plan for this group and for the committees. And so that is our goal. We're going to be harmonizing the work that we're doing there with the work that we're doing today on this meeting, and hopefully we can accomplish, last time we went through 5 of the 15 goals, as you may recall. We're going to try to get through the next 10 quickly today and thoroughly. And then at the next meeting, we'll be focusing on priorities for the IPRTF, and wanting to have our committees bring forward their priorities so that we can then in the next meeting in November create this 18-month, create and approve this 18-month work plan. So that's kind of the overall summary and goal. And Holly, would you like to begin?
Yeah, thank you, Peter. Good morning, everybody. Good to see you. So we're going to move through this process. Jill, can you pop up on the screen real quickly the agenda packet with the chart? And then scroll down to that first. Yeah. Okay, so here's what we're working on. We're really looking at each project in the implementation plan, and we're answering two questions today. So for each project, who on the IPRTF is involved and who is in a leadership role in the county? And then the second question we're asking is, does the project align with an IPRTF committee? And maybe a little detail on that. So we're going to go through, like Peter said, we're going to go through all 10 projects. We're going to have about 6 minutes per project, so it's going to go really fast. So I'm going to ask people to just, raise their hands, try and stay laser focused. It's important for us to do this as sort of like level set, like we're all getting on the same page here. So I don't want us to feel rushed, but we are going to need to stay as focused as we can. And before we get started, we just wanted to see, when you look at this, go ahead and scroll up for a second. Yeah, we're going to be on number 6, and we're going to take it off. We're not going to do this in live time. But did anyone get a chance to look at it? And if you did you have any corrections? Or, anything about what we've got so far that you wanted to make sure we got, accurate? Okay. If after
Holly, I'd
this,
like to say I went through it twice. I thought it was interesting, really helpful. It was exactly what we were looking for as a result. So thank you.
awesome. Yay. Well, after this meeting, we're going to be, recording this as we go. After this meeting, if you see anything else that needs to be added or clarified, just let us know. Okay, you can put down the screen, Jill. So we are on item 6. Everybody take a breath. Here we go. We are on the 6th here. I'll show it on my screen. Here's the beautiful implementation plan. And project number 6 is increase the capacity of existing programs to divert people from incarceration in tandem with community-based treatment and support services to enable people with behavioral health issues to successfully complete diversion programs. Got it? All clear. Hope you have this pulled up, but that's the thing. So we're increasing the capacity of effective existing programs to divert people from incarceration. So let's start with the first question. Anybody can jump in. Again, you can raise your hand with your screen on or use your raise hand button. So who on the IPRTF is involved in this? Any of you involved in that work? Yes, Lisa. And you want to go ahead? So Lisa and Dan, and can you briefly say how you're involved?
Sure. My staff basically deals with our clients who are the folks entering these programs and hopefully succeeding in them. And I think yeah, we have to have a lot of ties to the other community agencies and county agencies working on this, and we need adequate staff to work with the number of clients we have, which we don't.
Got it. Thank you. Dan?
Yeah, I've been working with the Swinomish tribe for the past year to increase methadone and Suboxone treatment options, and the Whatcom County Health Department has also been working much deeper than I have, and that should come online by the end of this year.
Awesome. Okay. And who in the county is lead on this?
Whatcom County Health Department.
Health Department?
Health Department, yeah.
We don't have anyone from the health department here today. So do we?
We have Melora as an attendee. I can promote her to panelist if you like.
Yeah, could you just, so we can confirm on these as we go along, so we don't, somebody else in the room, it's not in the room. Melora, does that match for you? You can give a thumbs up if you can. You were here a second ago, then you disappeared. Okay, we're gonna move on. So then the second question is, does this project, oh, there, no, Lisa, your hand's still up. Did you have another?
Sorry,
Yeah.
I should let you finish your second question. I just had the chance to look through the materials and I think that in the data, which I'm jumping back, this is what you asked a few minutes ago, to number 3, 2, I don't know, data should include the prosecutor's office and the public defender's office. I don't know. Sorry to take us somewhere
No,
else.
it's okay. Check. Got it. Thank you. Melora, did you catch that, health, I'm just gonna call it health department, forgive me for today. For item number 6, project number 6. Does that match for you?
Yeah, is it possible? I just asked Jill if someone can send me the document that we're working off of.
Yep.
But yeah, and I will review and then raise my hand.
Awesome, great. Okay, so now we're on to the question of, does this project align with any of our IPRTF committees? This is not I mean, it's not bad if they don't. We just need to see if any of them do. Yeah, Dan?
Yeah, behavioral health committee.
Mm-hmm. And do you want to say how, or I think that's enough because we need to be conscious of time. So,
And law and justice.
and law and justice. Okay, sweet. Anything else? All right, we're gonna move
Hey,
on.
Holly, one more thing. Probably
Please.
legislative agenda.
Mm-hmm. Nice.
Holly,
it?
I'm not seeing anybody from the executive's office on the call today. And I'm wondering, Barry, if you could channel them, if you would, and stand in for them. An odd ask of the chair of the council, but without them, this exercise is not as robust. So
Yeah, I can try, Peter, but
I know I'm not sure where they are, but
Well, and we can always follow up with Kayla or other folks later or Paul, right? We need to.
yes, we can.
Do your best. We know you always do. And I think we're gonna keep moving. Yes?
Okay. Yep.
Everybody? We got a bunch more to go. So item number 7, project number 7. So I'm reading straight from the implementation plan. You can click that. It's on your link as well. So item number 7, which is part of the goal area number 3, which is building facilities needed to promote public health, safety, and justice. And project number 7 is build a 23-hour crisis relief center, a behavioral health urgent care center, open all hours, 7 days a week, where individuals can stay for up to 23 hours and 59 minutes to enable prompt and appropriate intervention when a person is having a behavioral health crisis, to reduce use of the hospital emergency department and prevent incarceration. So this one again is build a 23-hour crisis relief center. And the question is, who in this group, who on the IPRTF is involved in this project? Yeah, Laura?
Health and Community Services is taking the lead with county facilities in partnership with other government partners that are helping with funding, but we are leading that project.
Great, awesome. Kim?
Melora said it perfectly. They are the lead. I'm bringing forth a budget next week that advances $1 million to support the funding for it. And I'm currently working with the county executive's office to invite Ferndale and Linden to join us in directing some of their opioid dollars towards closing that funding gap, as well as inviting Peace Health to make contributions as well.
Fantastic, thank you. Mike?
Yeah, good morning. Thanks. EMS is interested as well, especially for diversion and the opioid crisis as well. So the county medical program director would want to be directly involved in those diversion protocols, procedures, et cetera. So yeah, thanks.
Great, thank you. Dan?
I'll be recommending to my colleagues to support the mayor's budget request in support of this.
Great, thank you. Barry?
And just to channel the executive's office, as you asked, I would think Kayla would probably be the contact in the executive's office for this.
Good. Good. Heather?
The Chuckanut Health Foundation, in partnership with the prosecutor's office, has been hosting roundtables around the Involuntary Treatment Act. And this project has come up a number of times with the various audiences, with the designated crisis responders, with the people with lived experience. And they would love an opportunity to weigh in on the design of and the programming of the 23-hour crisis center, because they have lots of experience and suggestions that I think would be helpful.
Oh, fantastic. Okay, anything else? Other people who are involved? Yeah, Melora?
I just wanted to say, Heather noted, and I so agree, that's a great idea. Just want to be really clear with this group that the 23-hour crisis relief center will be a voluntary facility, not involuntary.
Thank you for that clarification. Okay. So second question, does this project align with any of the IPRTF committees? Yeah, Peter?
We're having some discussions about the crisis stabilization committee changing to a facilities committee or being wrapped back into the IPRTF main body. So you can put that on there, that we may well be changing its mission somewhat. Thanks.
Great, thank you. Okay, beautiful. Yeah, Heather?
Would the behavioral health subcommittee not feel alignment with that project? I'm just curious. It seems like it would fit there for reports and updates, but maybe not.
Yeah.
It just depends on the reshuffling of, are we doing a separate facilities committee that would be more germane to that committee, or would it fall to the committee that I chair with Stephen Gockley?
My thought would be that your behavioral health committee would be involved.
Okay, happy to do it.
Terrific, thank you. Okay, ready? We're going to move on then to item A. So build a new jail and behavioral health treatment center. That's the main topic. To provide secure detention and an array of rehabilitative services and diversion options, including facilities for people who pose a significant risk to public safety and alternatives for lower risk offenders, e.g., example given, work release. Additional facility space will be dedicated to a behavioral health treatment center that offers inpatient mental health and substance use disorder treatment as an alternative to incarceration. So, building a new jail and behavioral health treatment center. Who's involved in that one? Yeah, Lisa?
Stark is on the JPOP. Is that the kind of thing you're looking for?
Sure. Anything, any place where you're seeing that there's some involvement. That's great.
Yeah, public defender.
Great. Thank you. Kim? Oh, you're on mute, Kim.
Sorry. Yeah, the mayor's office and will be part of the JPOP committee and involved in those conversations.
Okie dokie. Great. Anybody else? Yeah, Melora.
Yeah, Health and Community Services hopes to be involved in the development of the behavioral care center in coordination with the sheriff, prosecutor, and defense.
Great. Thank you. Dan?
I'm the city council rep for for that committee, and then also just wanted to put on there that Michael Lilliquist is filling the role of the finance component of that. I don't know if we're getting to that right now, but that's the two of us will be working on that one.
Great, thank you. Heather?
And Peter and myself will be on that finance advisory board as well.
Great. Barry?
Yeah, I'm the council rep for both the J-POP and the finance committee, so I'll be working with that.
Wonderful. Okay, and the county lead for this project is who?
I
So,
would expect it to be the executive's office.
Exec's office?
I
Okay,
think Kayla again, probably.
yes.
Mhm.
great. Okay, and does it then connect to any of the committees of the IPRTF?
Well, J-POP,
J-POP?
behavioral health, criminal justice. And depending on what the facilities committee is going to be doing and where we're going to end up with that, I suppose that's possible too. I don't know.
Good. Okay, so I think with these projects where we have a lot of different facets, that'll be part of our work, right? To clarify which facet is going to what committee. Perfect. Okay, ready? All right, let's do it. Now we're going to move on to project 9. This project is to identify what additional facilities are needed to support people with behavioral health and substance use disorder issues at risk of incarceration. It's the main goal. So identify what additional facilities are needed to support people with behavioral health and substance use disorder issues at risk of incarceration, and bring people with lived experience and experts together to design solutions and propose new and expanded facilities. So who is involved in Project 9? Yeah, Melora?
Health and Community Services, specifically Hannah Fisk, Special Projects Manager, in partnership with the BHASO, and also with the Sheriff's Office and our embedded behavioral health and reentry staff. So that's a body of work that we're already working on and I think connects to this.
Great, thanks. And Melora, is Health and Community Services the lead on this project? Would I be guessing correctly there?
I don't know who gets to make that decision, but yes, this is a body of work that we see as ours. I again would defer to the other leaders in the room if we're the lead or not, but we do see ourselves as this is one of our roles.
Right, that was very gracious. Anybody to have a match for other people? Okay, all right, so I'm going to go back. I just was taking advantage of the moment. But let's go back to other places where people have involvement. So Dan?
Behavioral health subcommittee for the task force would take a lead on advisory on this, and this would be pursuant to exploring the development and expansion of the behavioral health campus at Division Street.
Right, thank you. Heather?
Just a request or I guess an invitation. I'd be really excited about a presentation at maybe it's the full IPRTF of a moment in time assessment when, like, if that's a deliverable of that, if there's an assessment of here's what we have, here's what we need, here's what the next 5 years of financing requests or building plans, so that we're all on the same page and we can all in our different hats and capacities contribute with advisory or funding, etc., and just have one community plan. I would love that.
So noted, thank you. Kim?
I like what Heather just said. I wanted to share that the city will have our new strategic initiatives manager that has a health and community services focus, will be the city's primary liaison. This, and actually number 6 as well. Jason will be starting mid-October, and to the degree that we consider our third spaces to be part of this solution, we're considering expanding investments in our library, continued renovations there, and also conversations about a multi-generational community center, or things like the skate park that we're working to advance. Those are active conversations happening at the city right now.
Thank you. Terrific. Peter?
Oh, I don't want to speak for Heather and the Chuckanut Health Foundation, but they certainly have been community leaders in advancing the conversation around this topic. So with Heather's permission, I would think that Chuckanut would be a partner in this.
Great. Thank you. Laura?
To Heather's ask around a deliverable, one of the things that our team is moving forward with, led by Hannah Fisk and Dean White, is updating the sequential intercept model and kind of rethinking what the SIM could be for us as a tool, and have a plan for regular updates. So Heather, I don't know if that meets the type of deliverable you're looking for, but our team is moving forward with that as an ask coming out of the Behavioral Health Subcommittee.
I think that will be an amazing foundation to build on, no pun intended. So thank you.
Awesome. Great. Anything else on number 9? All right, let's move on to number 10 then. So this is in the section of expanding the capacity of programs to reduce incarceration and reincarceration. And Project 10 is ensure people leaving detention and treatment facilities have transportation to a safe destination to avoid relapse and reincarceration. So is there anybody here who's involved in that project? Okay. Does it, yeah, Malora?
Holly, I would just say that, one of the things that the Response Systems Division has done in the last year is add a transportation staff. So we have one full-time position that works Monday through Friday, 8 to 5, that provides transportation supports throughout the community. I think that's different than number 10. But I will just note that that is something that we are already doing.
That's very helpful. Thank you. Bye, Lisa.
We work to try to get that for our clients, sometimes with county help, sometimes with other agencies.
Great. Thank you. Heather?
As it relates to reentry, the Chuckanut Health Foundation, in partnership with the Public Defender's Office and the Prosecutor's Office and the Sheriff's Office, hosted a reentry simulation. So it's not directly related. I mean, it is directly related, but it's advancing the goal in the cultural way, I would say. And we'd like to host one again. And I'm also curious about the new, pretty big re-entry contract that the Sheriff's Office just got. It's a $3 million plus contract that I'd love to understand what those funds are going to as it relates to these goals, and if there's an opportunity for us to help advise and make sure that they're productively, moving things forward too. So
That's great. We don't have anyone from the Sheriff's Office here right now, right? Not seeing anybody. Yeah, Peter?
Let's see. So WTA and Sheriff's Office have both been in this conversation and are going to be leaders in it. So I would draft them into your document.
Great. It's perfect. Thanks, Malora.
Yeah, I would also add just, I think, good situational awareness for this group. One of the things we've done with crisis triage at the Ann Deacon Center for Hope is we've contracted a cab company for when someone needs transportation and is unable to use our person. So outside of those Monday through Friday, 8 to 5 p.m., crisis triage is able to put someone in a cab, and then they invoice the county for that. So there are creative ways in which we can kind of fill these gaps, but I would have to agree that I think WTA and the Sheriff's Office, Swinomish has an incredible transportation system at their wellness center, and I think gives us a really good example of what something could look like, but it would take a significant investment.
Right, thanks. Thanks for that. Okay, yeah, Kim.
I would just say, as a WTA board member, we're continually looking for ways to provide added value for the community. And so if it felt appropriate and when we were ready to, I'd be happy to partner to bring that forward for board and programmatic consideration at WTA.
Fantastic, thank you. Okay, so the second question, and we're still on number 10, is does this project align with any of the IPRTF committees? Okay, so there's no committees that are working on that. That's fine. This is not like we can't do everything, right, Heather?
Oh, I would, I mean, this is all about helping people not come back to jail, right? Like reentry is really important. And as the Incarceration Prevention and Reduction Task Force, there is absolutely alignment. For sure with JPOP as the committee that's, you know, kind of supposed to be involved in all of these projects in some way. And I would guess, I mean, behavioral health in terms of programming, I don't know if law and justice, because of laws around things, the IPRTF as a whole, tell me if anyone disagrees with me, but I think it's squarely aligned with us.
Yeah, with the IPRTF as a whole, yes, absolutely. I think if there's a subcommittee that it goes to, that's what we're flagging right now. So we may not have, like you said, so Dan, actually, you can chime in on that behavioral health question, yeah?
I mean, sure. I mean, if there are behavioral health components to it, we're trying to apply guardrails to the work that we do, so we're not doing everything because we can't do that. But I mean, yes, yes to if there are behavioral health issues that some of the folks are experiencing, then yes, this piece is very important. But I think it speaks to a broader issue of where does this land? Like, what's the home for it, basically? And I think that needs to get decided.
Yeah. Maybe we can flag this too, Peter, when we're talking about the sort of rethinking of thinking about the restructuring of the committees. When we notice that there's maybe not a clear fit, or it seems that everything is getting moved into the behavioral health subcommittee, we can go, right? Like, how can we make sure to structure to hold the container?
Yeah.
These projects.
And let's not forget that we can create work groups within the IPRTF to handle certain things and then disband when they are solved. He says optimistically.
Okay, anything else on number 10 about safe having transportation? Okay, let's move on then. And folks, if don't hesitate if you have an idea or a question to raise your hand and jump in. Okay, we are now on to Project 11. And Project 11 is bolster reentry support services, including establishing locations where people can receive coordinated reentry support services, such as case management, peer support, and assistance with housing, employment, healthcare, etc. So bolstering reentry support services. So anybody involved in that? Yeah, Melora?
Yes, Health and Community Services holds the contract for our current behavioral health and reentry team. It's operated by Lifeline. Hannah Fisk is the lead on that, and in conjunction to the implementation plan and the Justice Project, this is work that we are very excited to be a part of, specifically, again, in partnership with the jail, defense, and the prosecutor.
Great. Thank you so much. Lisa?
Thanks. We meet regularly with the reentry team, identifying gaps and trying to work on those.
Great. Yeah, Jake?
Yeah, I would say to some degree, those court ordered we can be involved with as well, certainly. So thank you.
Great, thank you. Okay, anybody else? Yeah, Dan?
Yeah, this does not like fold in neatly to the question, but to the first part, but to the second part it does. So the city of Bellingham is establishing a community court, which will be able to refer people to services of the ones that Holly that you just mentioned, where the housing or kind of basic needs and things like that. It may or may not fall into the reentry category depending on where the person is at within the sim, but it could. I just want to get that on the board.
Thank you. Awesome. Yeah, Heather?
Some early dreaming from some Chuckanet teammates as well about like a place, a reentry coordination place. And I don't know if that's in everybody else's plans, but I wanted to also just put that out into for the record and be involved wherever appropriate.
Great, thank you.
I will just second Heather's point. One of the hopes is that we would have some sort of rapid reentry community resource center that could absolutely dovetail with other efforts like Mayor Lund was speaking to around a multi-generational space. We also believe that this might be one of the recommendations that comes out of the Division Therapeutic Campus design. For those of us that went to Columbus, Ohio, we got to see what a rapid reentry resource center looks like when you're released and you walk directly into a space where you're able to connect with resources, charge your phone, make some calls, use their transportation services. That could be part of the design at the new jail, but we would love to see resource centers like that available in the community.
Fantastic. Okay, so I'd like to, for folks who've joined in a little bit late, just to let you know that we are going through the projects in the implementation plan and asking the questions of who in the IPRTF is involved in these projects and who the lead is for the project in the county. And then the second question is, does the project align with an existing IPRTF subcommittee? So that's where we are. Feel free to jump in at any point and raise your hand. So right now we are on item 11, which is bolstering the reentry support services. So any other ways that people are contributing to that project that we want to make sure get out there? Okay, and my understanding is that Health and Community Services is the lead agency on that. Terrific. And then any subcommittees that are looking at this, working with this particular project. Peter?
Certainly J-pop.
Mhm.
Not surprisingly.
Great. Okay. Anything else on item 11? Okay, let's move on to project 12. So project 12 in the implementation plan is to maintain and expand supportive housing programs for people with behavioral health issues and a history of incarceration. For example, additional housing facilities, well-trained on-site clinical support, and housing case management services. So who in this group is involved in that project? Yeah, Dan?
Lake Wacom Center just made a presentation at the last Joint Behavioral Health and Legal and Justice Systems meeting, talking about the expansion of their services and in particular with housing. I would encourage folks to go back, or maybe Jill could send out some kind of summary of that or what have you. But there's stuff going on, and I think that needs to be on our radar screen.
Fantastic. Great, thank you. Malor?
Yeah, Health and Community Services already does a lot of funding and support to housing throughout the community. And so we will continue with that work, and that is through ANBEC's division. In addition to that, Hannah Fisk and Response Systems Division will be taking the lead on the True Blood capital projects. So we're very excited to be able to work with Lake Whatcom, with Pioneer Human Services, with Catholic Community Services, and other housing partners to secure and develop units specifically for current and former True Blood class members. And we would be able to do that and secure those for up to 25 years. So that we don't have a finalized announcement on that, but I'm sure Kayla has more information on that, but we'll want to share that with the task force and others as soon as it is finalized by the court.
Fantastic. That's great. Okay, Dan?
I'll be quick. So both the city and the county council unanimously passed House Bill 1590 about I think 2.5, 3 years ago. 40% of the dollars that are, it's a 1/10 of 1% sales tax. 40% of the funding can be used for mental health services, and then the other is for housing. It'd be helpful to have some kind of inventory as to how the city and the county are spending those funds to see if there's any opportunities that would be forthcoming.
Thank you. Well, great point. Yeah, Kim?
I would just add that I received a tour of the new Lighthouse mission facility, and their shelter in shelter models has a behavioral health focus. And while I don't fully understand how that will be staffed and what partners will be brought in to support that work, it would behoove us to pay attention to how that develops in our community.
Great, thank you. Okay. So are there any, let's move on then to the second question. Does this project, the maintaining and expanding supportive housing programs, align with any of the IPRTF subcommittees? Yeah, Dan?
Behavioral health. We're just going to do everything. Basically.
Yeah, that's what it sounds like. And maybe the facilities, Peter, what do you think? Would that make sense? If you moved to expanding that facilities program?
That's quite possible, yes.
Okay. All right. Any other subcommittees? Okay, let's move on then. You guys are doing great. We are now on to the last section of the implementation plan. And this section is titled Make System Changes with Local, Regional, State, and Federal Partners. And Project 13 is continue to make changes in court systems to reduce the number of people who are incarcerated, decrease the length of time they are detained before trial, and explore options in lieu of bail. So that is Project 13. So I see Kim and Maya Lisa and Rebecca, your hand went up, but anyway. Oh, I know, it's because your video's not on. So we'll take Kim and then Rebecca and then the rest of the lineup. Go ahead, Kim.
So the city's 2025 budget includes a request for an additional prosecutor to support therapeutic courts, specifically the community court, which will be coming online in Bellingham Municipal Court. So we're excited to make continued investments in our therapeutic court model. And additionally, a top legislative priority on the capital side that we've identified is a request for remodeling and relocating Bellingham Municipal Court. And when we do that renovation to a new future space, it would include a trauma-informed design and co-location for partner agencies, including Friendship Diversion Services and other partners in the building. That's the vision.
Wow, that is fantastic.
Love it.
How exciting. Okay, thank you. Rebecca, go ahead.
I didn't have anything. I was changing platforms from my phone to my computer. Thank you for upgrading me to panelist. I also need to just mention I'm glad to be back, but at 10 I have to switch over to some bargaining, and I'm going to ask Jason Monson to sub in for me if that's okay at 10 o'clock.
Great.
Thank you.
Okay, so we'll keep on going on. Continue to make changes in the court systems. And Lisa, you're up.
Many changes needed here for them. And I would add the pretrial services work group should be included.
Great, thank you. Yeah, Jake?
Yeah, I would just add the district court and district court probation would be involved in this, obviously. And we have ties as well. We just had a meeting recently with Bellingham for their community court, so.
Laura?
Yeah, Health and Community Services operates our mental health court, both with Bellingham Municipal and with County District Court. That has included an expansion of the mental health sentencing alternative, and so continuing to expand and work on that, and to consider whether the small cities should also be engaged in terms of mental health court and therapeutic courts. I will also say that our work with LEAD and the Bellingham Police Department and both Bellingham City Attorney and Whatcom County Prosecutor around doing pre-charging diversion to the LEAD program. And we are right now in conversations with BPD and the City Attorney on doing pre-arrest diversions and starting a pilot project with LEAD with just a few officers. And so, all of that definitely asks the system to change and reconsider the process. And so we're excited to continue doing that work that is program specific, but that does impact the system.
Fantastic, thank you. Yeah, Arlene. And you're muted right now. There you go.
Is anyone letting the public know about any of these important changes, especially in the police department and so forth?
Yeah, Dan?
To speak to Arlene's question, we're still in the process of vetting these ideas and appropriating the funding. And I just wanted to chime in to say that I will be supporting the mayor's request moving forward in terms of providing a trauma-informed care court building or facility moving forward. We just toured the Tukwila new Justice Center with the mayor and council members and our elected judge, and we're just really we had some great ideas coming out of that. So I think that there's a lot of room for improvement here, and we can and should do those things. I'll be supportive 100% behind the mayor.
Thank you, Dan. Arlene, did you? Arlene, can I just flag? I think that question about communication is super, super important and also broader, right? Like to how are we
Yeah, I want the public to know everything that we're doing, because we've been working hard on this for a long time, and it's coming. I guess you want to be sure that you have it down permanently instead of an idea.
Yeah, but it's still, the communication piece is so critical, and I know we're going to be looking at that more. Okay, so we're still on number 13. So any other involvement and continue to make changes in court systems goes on. Anything else people have? Okay, and the lead, I think, who was the lead? I feel like maybe it was community health and community services again. Is that what I heard correctly? No. Working.
We're talking about 13 still.
Yeah.
I mean, I think, we can be a convener, but without the buy-in of the legal system partners, specifically judges, administration, the prosecutor, defense, like we can't lead this conversation. Because it's not our work. We run programs that overlap with that, and we have a lot of recommendations around what would make a difference in the lives of our community members. But I think it has a lot more impact when it's led by the partners that are doing that work and own that work.
Yeah. Appreciate you, suggesting that you could maybe be in a convening role. But let's dig a little deeper then. So who is in leadership really on this? I'm gonna read it again. Continue to make changes in court systems to reduce the number of people who are incarcerated, decrease the length of time they are detained before trial, and explore options in lieu of bail. Yeah, Kayla?
Sorry. Hi, everyone. I mean, I think as Melora was saying, right, it is the criminal justice system, our law and justice system that will be the ones implementing those changes. But I think, right, we're looking at multiple different jurisdictions, multiple different separately elected offices. And so I really see the IPRTF as the leader here in convening those partners and pushing towards reform, because difficult with all the different pushes and pulls of different parts of the system and how they affect one another. And so the IPRTF sort of serving as this neutral policy convener seems like a really appropriate role and within the mandate of the IPRTF.
Great, thank you. Bertie?
I see Raylene's hand up, so I may be preempting her, but I was thinking that this sounds like it might be in the purview of the Legal and Justice Committee subcommittee, because if you look back at the original role of that as established by the state, I think that's part of it. But I will defer now that Raylene has her hand up, because you, as chair, probably have a lot more to say.
Thanks, Bertie. Raylene?
Thanks, Bertie. Thank you, Maura. I think a lot of this comes under legal and justice, but as we have noticed before, when we talk about some of the issues that are in legal and justice, there's such a crossover with a behavioral health. We're so intertwined in all of the issues that we have to work together, which is one of the reasons some of those joint meetings actually can help as we look at reentry to reduce recidivism. That comes under all of us. It's not just one little area. We're all intertwined, and so that's where we really need to work together. We can have meetings in legal and justice or subcommittee, and we can look at what areas we think we can help to reduce incarceration. But like I said, we start and then we realize, well, we really need to talk about housing, and we really need to talk about reentry and mental health and competency and restoration. And when they are released to go to get restored, and then they come back, and then we're restoring them again because they failed to take their medications while they're incarcerated waiting for a trial. I mean, it's just a revolving process. What other steps can we do? I mean, just some of our parties meeting together to see how we can get cases resolved quicker in timeliness. I think it's a bigger picture. It's not just one specific area. By all means, I think the Legal and Justice Subcommittee will work on what areas we can do to reduce incarceration, reduce time. I mean, that's where the Pretrial Services Committee for Superior Court is coming in, but there are pretrial services that Jake and his team and probation are working on with the small cities. And, Ferndale has their own probation and their own pretrial program for misdemeanors and gross misdemeanors. And those cases have issues. And now we're facing possibly more of a public defense shortage, which is going to greatly impact our work on this. So there's lots of different avenues that we have to look at. That's what I have to say. Thanks.
Thank you, Raylene. Rebecca?
I mean, I think a lot of this lies on first responders. You're talking about that decision when there's an encounter with the criminal justice system, whether someone goes to jail or somewhere else. Those are made by our officers, and they do a really good job of trying to use a lot of discretion. But we need more options for them that when you're encountering someone who you clearly know is having a mental health crisis and they're not crossing that line into an ITA, what do we do with them? I mean, right now, what do we do with them? So that's a large part of this work, I think. And like I said, I think our officers do an amazing job of trying to problem solve and get to the why of every crisis they're involved in. But there's only so much they can do in the very limited time they spend. And when it's very disheartening to encounter the same person experiencing a mental health crisis, but you're encountering them because they're victimizing the community. They're victimizing people. And so they're constantly in this crossroads of, well, I want to keep my community safe, but I know this person doesn't really belong in jail. So it's up to us as leaders to figure out what they can do with that person.
Thank you. Spot on. Peter.
I just want to point out at this moment, we have such a good, juicy conversation going. Next meeting, we will be focusing on priorities, and this subject is one of the priorities that came out of the work that Heather and I did with our findings and such. Just to say, be thinking about where we're going to be putting our priorities in the next 18 months. And so with that, thank you.
Thank you. Okay. And so that was really a fantastic discussion. I'm just want to go back. Did we clarify which of the subcommittees of the IPRTF is involved in this, or it aligns with?
Law and justice, that's kind of what I heard.
Yeah.
Law and justice and also pretrial. And then J-Pop, Marty, just put obviously, J-Pop is here to address all of the implementation plans, so it just goes down the board, so thank you.
Okay, terrific, thank you. All right, so let's move on then. We've got 2 left, so you guys are doing great on time.
Jason's gonna have the helm for me. Sorry, I'm gonna have to dip out.
Okay, thanks. Thanks for being here. And welcome, Jason. Glad you're here. Thank you for being here.
You bet. Thank you.
Great. Okay, so we are on item 14. Expedite access. This is the project. Expedite access to competency restoration services through advocacy at the state level and exploration and development of outpatient alternatives. For example, a prosecutorial diversion program, assisted outpatient treatment. So who is involved in that one? So expedite access to competency restoration services. Melora.
Yeah, thanks. So Health and Community Services, again, would be taking the lead on the True Blood Capital Project, which essentially has, been connected to the competency restoration conversation. In addition, and I'm sure Councilmember Buchanan will speak to this, but the Competency Restoration Work Group has been doing some really great work on what a prosecutorial diversion program, or PDP, could look like. And we would love to see that as part of the development of the Behavioral Care Center, which in my view is a PDP.
Right, thank you. Gary?
Yeah, kind of a task that Melora and I have taken on since Perry has left. Perry and I formed the competency restoration work group, but Perry was really the leader of that group that set the agendas. And we are now, Melora and I are talking about where does that work belong, and I know we're going to be meeting with the prosecutor's office to find out some of their thoughts on some of these prosecutorial diversion programs. So that's kind of where Melora and I are definitely working on this.
Right, thank you. Lisa?
My office usually identifies this initially and then ushers our clients through the process.
Great. Okay, Dan?
Yeah, I just wanted to chime in that I serve on that team for PDPs and True Blood with the folks that just spoke. So there's city involvement, basically.
Fantastic. Okay, any other folks who are involved? All right, and to clarify, what is the lead agency for Project 14?
I think that actually falls under both behavioral health and legal and justice, but it's a subcommittee of the competency and restoration group. So I think it's again a combination.
Right, thank you. So that's for the task force. How about the county lead would be?
In terms of the ideal situation, our prosecutor's office would lead that work in partnership with Defense and Health and the exec's office, taking recommendations from the task force.
Great, thank you. Any feedback on that point? Okay. Great. So now we are on project 15, the final project in our implementation plan. And this one is advocate for a state waiver to allow use of Medicaid funds to pay for medical and behavioral health services for incarcerated individuals. Obtaining a waiver would ensure greater access to care for individuals while incarcerated and continuity of care upon reentry to the community. Yeah, Kayla.
Yeah, so the waiver has been secured, which is a great step forward that the legislature has taken, and they sort of are charting a pathway towards fully funding. So I'm not sure that state advocacy on the legislative side is what we need. It's more sort of regulatory advocacy as they work on the rulemaking process. This is sort of something that's at the intersection of the exec's office, health and community services, and the sheriff's office, as well as our juvenile detention, which is in Superior Court. So both juvenile detention and the sheriff's office each just signed $2 million contracts for startup funds to bring essentially like build the capacity they need to build Medicaid starting mid-2025. So our sheriff's office and Superior Court are in the lead, but this is certainly going to take really strong partnership across sectors of government, right? Because we're coordinating services and there's a super strong health angle here. So our Health and Community Services Department, both Melora's division and our communicable disease folks are really, really involved in this effort as we think about what healthcare services look like going forward and we get ready to build Medicaid. So I don't know, Melora, if you want to share more. I see Maya has her hand up as well.
Great,
I was just going to say, to the extent that that advocacy could use storytelling to convey the reality and of it to help be more persuasive, our office is a good resource for that.
Awesome. Thank you. Melora?
The only thing I would add to Kayla's points is just that Health and Community Services in partnership with the North Sound BHASO, making sure that that connection, and then also to the North Sound ACH, or Accountable Communities of Health, as they have some reentry initiatives. So just that work around connecting to our regional partners around this work and making sure that that's part of that we have a shared legislative agenda and that our legislators are aware of this work as well.
Right. So it sounds like a really, like it's moving forward. It's very collaborative. If you were going to say, here's the one person who's in the convening seat for this, who would you say that is? If we had to call somebody and ask.
I think we're not quite ready to make that call yet.
Okay. Great. But it sounds like it's moving forward. That's awesome. Yeah, I mean, this has been a huge one for so long. Okay, so, and then let's move, I'm so excited to hear this. Let's move on to, do any of the IPRTF subcommittees align with this project?
Holly, I think that's probably behavioral health, legal and justice again. I think we need to include reaching out to the jail though as well.
Yeah, great point. So they're in the loop on this. Super important. Yeah. Okay, anything else? All right, gang, that was amazing. You guys made it all the way through. We're on time. And as we get these, as Marty, she's been typing as we go. She'll double check against the video recording to make sure we got all the points. And then really, it'll be terrific if you can take time. We'll give you a sign, like to review it and make sure there's nothing that's missing or inaccurate. And And that'll really help us in this next step, which is Peter mentioned earlier, is then to do some prioritization for action. Like, what are we going to really try and make sure that we get done in these next 18 months? So awesome work. Thank you all so much. Peter, do you want to wind up?
Yeah, I had some, Marty, would you circle up with Kayla? And since she was not here in the beginning of the meeting, just get her eyes on all the things that we went through, make sure that, from the executive's office point of view, everything looks correct.
Yes, definitely.
Thank you so much. Okay, well, that's great. Jill, would you put the agenda back up on screen? I believe our next item is discussion around the legislative agenda. Are there IPRTF recommendations to the county executive, county council, and others for the upcoming Washington State legislative session? Lots of conversations going on all around town around our upcoming legislative session. Who has some items for us to put forward? Dan, go ahead.
Yeah, this is more of a structural. I'm not going to. I might comment on some items, but this is more of a structural piece. I want to make sure that everyone here understands fully that the city and the county and the port no longer have a shared legislative agenda, and that we are each doing our own items. And we just met the city with mayor, myself, and leadership. Met with our new lobbyist and with our 40th district delegation, and we're beginning that process. We have a very, very long list, and we're paring it down. But I do want to make sure that we have some level of alignment with this task force's priorities, the county's priorities, and the city's priorities. And as far as the port, that's a different story. But I would like to make sure that we talk about some of the high level things that came up during this discussion around behavioral health priorities when it comes to the behavioral health care center. There's also the perennial discussion around ITAs. And so what are we asking for, or are we asking for anything when it comes to that? That's a long list. So I just wanted to put that out there, that structurally things have changed, and we just need to be aware of that. That's all. Thanks.
Thank you, Dan. Raylene.
Thank you, Peter. Off the top of my head, I would say, we've got these unfunded mandates that pop up all the time that affect the legal and justice groups. The one that I see coming at us that's already a struggle is public defense and needing funding from the state to assist the counties and the small cities on paying for public defense. So that would be one area. I can see that we would need funding. Other ones that just pop into my mind is they just changed the rules on appellate, that now the Superior Court County Clerk has to provide more documentation and color for individuals that are appealing. That is going to be an increased cost that we probably weren't expecting. I'm trying to determine what it is, but as those things come up, we have to provide things for appeals as well, and it really affects funding. I don't know how much that actually hits the task force, but those things, when they come out, the mandates that we need the funding for it, because the county doesn't have the funding to support those areas. Otherwise, no domestic violence, no contact orders. Those are also things that we're dealing with here that require a lot of staff time. So when they put that mandate in, we need to make sure that we can adequately do the job. So I would look for funding for that as well. Thanks.
Thank you, Raylene. Do others have some suggestions that they would like to make as far as legislative agendas. Okay, oh, yes, Melora.
Yeah, I will just add that Health and Community Services is working closely with the exec's office on our legislative priorities. So we're in the process of getting that communication to the exec's office. And then in addition, going back to the regional North Sound BHASO, we have a legislative summit with them coming up in a few weeks to try to make sure that the county's priorities are represented by the ASO as well.
Fantastic. Thank you so much for all that work. Dan.
Yeah, I just want to emphasize the priority around investments in behavioral health workforce capacity to make sure that we've got the workers to do the work and that they're well compensated. The public defender piece came up before. I think that cannot be underscored enough. And then also, we don't talk about it a lot, but DV offender treatment would be helpful to have investments in that.
Thanks, Dan. Birdie, go ahead.
Yeah, I just wanted to second what Dan was just saying about behavioral health, particularly in terms of reimbursement to behavioral health workers, because that's one of the biggest issues that drives some of our shortages. And we talk about it a lot, but there hasn't been a lot of action. And the other is a smaller piece in the budget, but I think really important, and that is in the way we do substance abuse treatment in the jail. We can't pay for the injection form of buprenorphine. And, you know, all the money that we're investing in reentry services and people for medical use, for substance use disorder, if we could give them an injection when they left the jail, that would last 30 days and we wouldn't have to invest other funds. And there are places around the country that are doing that very successfully. And the barrier is finance, and particularly Medicaid coverage. So I think that may deserve to be called out as a separate and important legislative agenda. Thanks.
Thank you, Birdie. Would anyone else like to address this issue? All right, thank you so much. And Jill, would you throw the agenda up again? We're doing marvelously well on time, everybody. Okay, committee updates. Let's go through them one at a time. We'll start with behavioral health, then do steering, and then the joint meeting of the behavioral health and legal and justice. Dan, would you like to take behavioral health?
Oh, wow. August 20th seems so long ago. I don't know if I can recall exactly what we talked about. But I do want to, I really want to talk more about, and I'll cover what our part of the joint meeting is, but I do want to let the group know that Stephen's on the call here. I think he's in the guest room or the guest area, whatever that's called. We are trying very much to rebuild the Behavioral Health Committee. We lost several members due to job transitions primarily, and we've been reaching out to a very focused group of people that we think that can provide the information and the background that we need. These include line folks. These are for example, Captain Steve Larson from our community paramedic program is on our committee, and we've got Keith Johnson on our committee who will be transitioning off, but will be replaced by another person coming in. We've invited folks from Lake Whatcom, from Whatcom Community College, that are doing training programs for people in behavioral health. So it's a very comprehensive and very strategic way for us to rebuild that committee with an emphasis on providing action and implementation of policy recommendations. At the joint meeting, we had Dr. Shannon Boosted, who works for CMAR and is a quite remarkable person. He did a presentation at Bellingham High School on addiction recently. It was very well received. We had Andrew from Lake, and pardon me for forgetting his last name. Hobenden, I think is his last name. He from Lake Wacom Center, talking about the expansion of the Lake Wacom Center's programming and housing. It's quite remarkable. I encourage folks to go back and review the video from that. We also have Lisa Marks from the Carpenters, I think it's 231 local. She works within the DOC system on getting folks in apprenticeship programs as they're transitioning out, so they can kind of land with good paying jobs, and provide for their families and just kind of recenter their lives. I think that the vocational rehabilitation component of what we do is probably our weakest thing, and I think that we need to focus in, and that's why I asked Lisa to come in. We talk a lot about behavioral health, treatment options, things like that, but we don't talk a lot about jobs, and jobs change lives. And so I think that we really need to focus in on that piece of it. So that we'll be working towards that, and as much as we can. We had a successful meeting. We were not able to get to Brian Estes, his presentation for NAMI. So he's the local chair or co-chair of NAMI, talking about he wanted to discuss mental health. That'll come up at the next meeting. So we continue to have very full agendas, and I think that I'm really proud of the work that our members do, and looking forward to more as we pursue the rest of the year. And special thanks to my co-chair Stephen Gockley, he's one of those guys who can never retire. We won't let him retire. It's just not happening. So, but he's been such a great asset as a co-chair. So, and that concludes my report. Thank you.
Thank you, Dan. I'll second that on Stephen, and also on the meeting itself. I would like to point out that Jenna Gernan takes excellent notes, and you are able to go to the IPRTF website at any time, review notes, review video. That was a spectacular meeting. I thought that Dan was referring to the joint meeting. There was a lot there, and Jenna's notes probably, I haven't looked at them, but they probably cover it very, very well. So encourage any and all of you to use those notes as a resource for sure. Barry, is there anything you'd like to say about the steering committee meeting at the top of the hour, top of this meeting? I kind of went through some of the things that we talked about, but do you have any other remarks, Barry?
No, that's exactly what I was going to say, Peter, that you went over the meat of what our steering committee was about, which was you and Heather's work on the subcommittee listening tour, basically, that you went on. I guess I would ask, do you have what are you thinking are next steps with that process of your report?
That is an excellent question. I'm not prepared to address that here.
Okay,
we
can talk offline, and
yeah,
I'd love to see how that's going to move forward. Definitely.
Yeah, absolutely. No, we want to get everybody prepared for the October IPRTF meeting, so that we can make some really good priority decisions. And so we'll be circling back with everybody. So thanks, Barry.
Yep.
Okay, we're on to other business. Is there anything else anyone would like to bring up before we have public comment and then close out the meeting? Any other business? Hearing none. Jill, where are we with our attendees? Do we have some folks? I can tell you right now that I am the only person in the conference room, so.
Thank you. Yes, we do have a number of attendees. If you would like to speak to the task force, please virtually raise your hands now. Brian, I understand you want to speak. Go ahead and speak to the task force.
Yes, can you hear me?
Yes,
we can.
We discussed this briefly at the last joint Behavioral Health and Law and Justice Committee, and I apologize that I missed the first 20 minutes or so of the meeting. But my sense in terms of legislative priorities on the capital side is there is a desperate need in the five, county region that the ASO covers for a pediatric inpatient facility. As many of you know, youth with serious mental illness remain at Peace Health for weeks or months until they can be placed in a facility, often anywhere in the country. That's how dire the situation is. And so I strongly encourage the city and the county to include that in their list of legislative asks for capital projects this year. I know it's perhaps outside the stated purview of this task force and others because they have, focused on issues related to adults. But in terms of prevention and just fairness to families whose loved one is a child and has serious mental illness, this is something we desperately must address. So I'll just leave it at that. And the 2022 analysis of the ASO in terms of inpatient needs, this was one of their top priorities. So this is, I can send, I assume some of you have seen that needs analysis on this group or Melora or other people and are familiar with it. But I'm not just making this up. They had a consultant who analyzed future and projected inpatient needs, and this was one of the ones that rose to the top. Melora, did you have any comment on that, or I'm just curious?
Oh, Brian, no, I appreciate you bringing it up. And I think it's very important that that is at the forefront. And to emphasize your point that treatment is what's needed, not necessarily like a urgent care model. The need across the state is so acute for treatment, which is why folks are staying at the hospital. So I'll just add that to your comments, Brian.
Would that particularly lead to specific capital projects beyond? I know we have 23-hour facilities, but I'm talking about somebody who needs, weeks and weeks in an institution. And my sense is that just really isn't there for youth right now.
We seem to have gone beyond just public comment, but Kayla, go ahead.
Yeah, sorry, I know we're in public comment. I mean, I think
no, that's fine.
One of the challenges we're facing, Brian, is like there's so many acute needs, and the county only has the capacity to do one facility project every few years, both from a revenue standpoint as well as just like a logistical standpoint. So I mean, I think in other communities, we're seeing county governments advance some of these projects, and we're also seeing the nonprofit and the private therapeutic sector advance some of their own projects and apply directly to the state. And I think we need some more of that here so we can pursue multiple projects at once.
Well,
yeah,
I would just suggest, and then I'll stop, is that perhaps the Association of Washington Cities, Association of Washington Counties, this should be a legislative priority for those groups and bring a number of counties together to request that this need really is very important across the state, including the North Sound region. Thank you for your time. I know.
Thank you, Brian. Is there anyone else?
I just had one thing for Brian real quick. Brian, we're having a behavioral health subcommittee meeting for the Swiss group. That's all 5 of our region's counties today. Could you email me some details around what you're asking? Because I want to bring that up when we meet later on this afternoon.
Mm-hmm.
Okay. Do we have other members of the public who would like to speak to the IPRTF?
If anyone else would like to speak, please virtually raise your hand now. No additional hands are raised. Raylene, if you don't mind staying after for a minute for a quick question, that's all I've got. Thank you.
All right, thank you. And with that, we'll close the IPRTF Law and Justice Council meeting for this month, and giving you back half an hour, 35 minutes of your Monday. So let's do it, everybody. Thank you so much for participating. Appreciate all of you.